Let's talk about pneumonia. It is an infection of one or both of the lungs caused by bacteria, viruses, or fungi. It is a serious inflammatory condition of the lung, primarily affecting the small air sacs known as alveoli. Then, what is an alveoli? Now you can see here, these are microscopic balloon-shaped structures located at the end of the respiratory tree where the lungs and the blood exchange oxygen and carbon dioxide during the process of breathing in and breathing out. Do you know what is another name for pneumonia? It's also known as pneumonitis. Not only that, the term old man's friend is often used when referring to pneumonia. Let's see the causes and types of pneumonia. As we said before, the main causes are bacteria, viruses, and fungi. Pneumonia can be categorized by which pathogen caused it. Here, bacterial pneumonia, viral pneumonia, and fungal pneumonia. Bacterial pneumonia tends to be more common and severe than viral pneumonia, more likely to require a hospital stay. The bacteria that most causes pneumonia is Streptococcus pneumoniae, can spread from person to person. Next is viral pneumonia. It is caused by virus. For example, the flu, common cold, COVID-19 are the most common causes of viral pneumonia in adults. And in young children, respiratory syncytial virus is most common cause of viral pneumonia. Fungal pneumonia. It is an infection of lungs by fungi. For example, Cryptococcus blastomycosis. In a healthy individual, fungal infections are more likely to resolve on its own. But immunocompromised persons are most at risk of getting pneumonia from a fungus and will be much more serious. Fungal infections aren't spread from person to person like viruses and bacteria. And what about protozoa? Rarely, protozoa like Toxoplasma cause pneumonia. Let's move to another classification of pneumonia. It can also categorize into community acquired pneumonia, hospital-acquired pneumonia, healthcare-associated pneumonia, and ventilator-associated pneumonia. What is community-acquired pneumonia? When you get a pneumonia outside of a healthcare facility, the most common cause of CAP is pneumococcal disease, which refers to infection with Streptococcus pneumoniae bacteria. Other bacteria which cause CAP includes Haemophilus influenza and Chlamydia pneumoniae. Other examples for CAP includes common cold, COVID-19 and pneumonia caused by RSV. Hospital-acquired pneumonia. You can get hospital-acquired pneumonia while in a hospital or healthcare facility for another illness or procedure. Hospital-acquired pneumonia is usually more serious than community-acquired pneumonia. For example, MRSA, which makes you sicker and be harder to treat. Healthcare-associated pneumonia. You can get pneumonia while in long-term care facilities such as nursing home or outpatient extended stay clinics. Next is ventilator-associated pneumonia. It's a type of lung infection that occurs in people who are on mechanical ventilation in hospitals. Pneumonia, it has some additional classification. It includes aspiration pneumonia, atypical pneumonia, bronchopneumonia, and lobar pneumonia. What is aspiration pneumonia? It is a type of lung infection that is due to relatively large amount of material from the stomach or mouth entering the lungs. It can be solid foods, liquids, or vomit go down your trachea and to your lungs. If you can't cough these up, your lungs can get infected. Next is atypical pneumonia. It's also known as walking pneumonia. This is an infection is caused by different bacteria than the more common ones that cause pneumonia. And you know, this is a mild lung infection. Just an example, Mycoplasma pneumonia causes atypical pneumonia. Bronchopneumonia. It is the subtype of pneumonia and the acute inflammation of the bronchi accompanied by inflamed patches in the nearby lobules of the lungs. The last one, lobar pneumonia, is a type of pneumonia characterized by the infection and inflammation of one or more lobes of the lungs. It is typically caused by bacteria. What is the most common way to get pneumonia? Pneumonia is mostly spread when people infected cough, sneeze, or talk, sending respiratory droplets into air. These droplets can be inhaled by close contacts. Less often, you can get pneumonia from touching an object or surface that has the germ on it. Let's see the signs and symptoms of pneumonia. It can range from mild to severe. It may be different in young children and older adults. Here is the signs and symptoms of bacterial pneumonia. It can develop gradually or suddenly. It includes high fever and chills, chest pain, shortness of breath, weakness, cough with yellow, green, or bloody mucus. rapid breathing, rapid heart rate, loss of appetite, cyanosis and confusion or altered mental state. Now the symptoms of viral pneumonia. It usually develops over several days. You might have a symptom similar to bacterial pneumonia, or you might additionally have dry cough, headache, and muscle pain. Babies and newborns may not show any symptoms of pneumonia, or their symptoms may be different from adults, including fever, chills, general discomfort, sweating, cough, difficulty breathing or rapid breathing, loss of appetite, vomiting, lack of energy, and restlessness. The signs you can look for babies are wheezing, which means a high-pitched whistling sound that can occur during breathing when the airways in the lungs become narrowed or blocked. Next is grunting sound, which refers to noisy breathing, similar to growling. What is growling? You may hear the dog growl at him. Growl is a rough sound, usually in anger, but grunting and growling are not same. What I am trying to clear that the grunting sound in pneumonia almost similar to growling. The difference is grunting sound is due to when the body tries to keep air in lungs, but growling sounds from actual vocal cords. Also in babies, you can see pale gray or bluish colored lips or nail beds caused by decreased oxygen in the bloodstream. Then flaring, which means widening of nostrils, and chest pain, especially with coughing or deep breathing. Symptoms of pneumonia in adults over 65 or those with weakened immune system may have mild or less noticeable symptoms of pneumonia. But remember, symptoms of ongoing health conditions may worsen. What are the stages of pneumonia? Stage 1 congestion, Stage 2 red hepatization, Stage 3 grey hepatization, and Stage 4 resolution. Stage 1 congestion. This is the first 24 hours of infection. The lungs become heavily congested due to buildup of fluids accumulated in the alveoli. Next, stage 2 red hepatization. In this stage, red blood and immune cells accumulate around the alveoli to help combat the infection. It can last for a few days. During this stage, swelling around the alveoli is replaced with fibrous tissues that try and firm up the lung tissue. Stage 3 grey hepatization. In the third phase of pneumonia infection, fibrous tissue increases as red blood cells are destroyed. Hemosiderin, the protein that stores in iron in the blood, may also start to accumulate. These changes can cause the lung tissue to discolor, giving it a grey appearance. This stage usually appears around 2 to 3 days after red hepatization and can last up to 8 days. Stage 4 resolution, the last stage of infection. The resolution phase is when infected patients usually start to feel better. It typically occurs around the 8th to 10th day after the infection and can last up to a few weeks. Next is diagnostic measures, history collection and physical examination, then auscultation. People with bacterial pneumonia can have wheezing, rales, rhonchi and pleural rap. Then chest x-ray, blood test or sputum test, pulse oximetry for checking oxygen levels in your blood, CT scan, pleural fluid culture. Pleural fluid culture is a test that examines a sample of fluid that has been collected in the pleural space to see if you have any infection. Then an arterial blood gas test or arterial blood gas analysis measures the amount of arterial gases such as oxygen and carbon dioxide. Your healthcare provider takes a blood sample from your wrist, arm or groin. Next, bronchoscopy. Bronchoscopy is an endoscopic technique of visualizing the inside of airways for diagnostic and therapeutic purposes. Here, an instrument, bronchoscope, is inserted into airways, usually through the nose or mouth or occasionally through a tracheostomy. Let's see the treatment. It includes administration of antibiotics like azithromycin or doxycycline. In case of viral pneumonia, antiviral drugs may be given, and in fungal pneumonia, antifungal drugs can provide as well. But remember, these type of pneumonia resolve its own. Next is administration of antipyretics and analgesic. Then oxygen therapy, IV fluids to prevent dehydration, cough suppressants. These should be taken according to doctor's order because it is essential to clear the mucus from the lungs through cough in pneumonia. Nebulization. It can help loosen the mucus in your lungs so you can breathe better. If pleural effusion present, the healthcare provider will drain the fluids through a catheter or surgery. What is pleural effusion? It is accumulation of excessive fluid in the pleural space, which means the space between lungs and chest wall. If you are in a home care settings, you can use a humidifier and take warm bath or shower and avoid fried and fatty food plus alcohol and caffeine usage. Because fried and fatty foods may be difficult to digest and may cause body to become more inflammatory. Alcohol and caffeine have a potential to cause dehydration. Let's see the risk factors. Age over 65 or under age of 2. Patients with lung or heart condition. Patient with neurological condition because it increases risk of aspiration. Cigarette smoke, pregnancy, and have a weakened immune system. What are the complications of pneumonia? ARDS, acute respiratory distress syndrome, pleural effusion, sepsis, and lung abscess. Vaccinations for pneumonia. Pneumococcal vaccines are available to protect against pneumonia bacteria. Also, vaccination against virus can help to reduce risk of getting it. Just an example, getting vaccinated against COVID-19 and flu. If this video really helps you, please like, share, and subscribe my channel. Thanks for watching.